New research warns depression could be a side effect of more than 200 commonly prescribed medications. They include beta blockers for blood pressure, birth control pills, antacids, and painkillers. The new study in the Journal of the American Medical Association says more than 1/3 of Americans are taking these drugs. Depression rates more than tripled when people used at least 3 drugs with a possible side effect compared to people who take none of these medications. Our Dr. Narula is a cardiologist at Northwell Health. She joins us at the table to discuss it because I can hear a lot of people listening to that feeling a little unsettling when they hear that news. How was the link discovered between those medications that a lot of people take and depression?
So researchers looked at data from a survey of about 26,000 Americans over a 9-year period. They asked to look in their medicine cabinet at their prescription bottles that they had used in the last month. They also screened them for depression, and they found that about 37% of those were taking at least one medication that had a side effect listed of depression. They also found that the numbers of Americans taking meds that have side effects listed as depression increased over the 9-year period. If you were not taking a medication that had that listed as a side effect, in that survey you had a 5% chance of depression. That's compared to about a 15% risk of depression if you were taking 3 or more drugs that had depression listed as a side effect. And as you mentioned, all types of drugs, oral contraceptives, blood pressure medicines, some stomach antacids, pain meds.
A lot of numbers there, Tara, so I'm curious, how worried should people be?
Well, I think it's important to kind of open the dialogue about polypharmacy and about side effects. And so, it's hard to prove this link with this type of research. So it could, in fact, be that the drugs are leading to depression. However, it could be that people had pre-existing depression. Okay, it could be that the chronic conditions they're taking the medicines for, heart conditions, cancer, other conditions, is what's really causing the depression and not the drugs.
Explain to people what polypharmacy is.
Meaning that you're taking more than, multiple medications.
Well, in fact, the number of Americans taking at least 5 prescription drugs at the same time rose sharply in the last decade.
Yes, exactly.
That's alarming.
It is. And so I think that people, patients, pharmacists, and doctors all need to be part of this discussion. So patients need to bring up their history when they go to the doctor and say, I have a history of depression. Tell me if that's going to impact the meds I'm taking. Do I need to be on these meds? How long do I need to be on them? Also, doctors need to screen for depression. It's recommended by the U.S. Preventive Task Services Force that every American adult be screened for depression. And a lot of times when you go to a doctor, you go to a specialist, right? A cardiologist or an orthopedic, and they may not be looking at the whole picture of everything you're taking. So the primary care doctors really need to be, in some form, the quarterbacks, analyzing everything you're taking, or a psychiatrist or psychologist, and seeing, is there something that could be interacting here? And the pharmacists play a role as well.
And isn't this a part of a larger problem, which is people don't look at the side effects? So what should people do who've now listened, who are now paying attention? What's the next thing they should do?
So you can read the package insert of your prescription meds. But the other issue is some of the over-counter the medicines like proton pump inhibitors, they don't have all these things listed. So talk to your pharmacist, talk to your doctor, ask questions.
It's good we're just having the conversation, period, because so many people don't want to say it out loud.
No, and I think if anything, this is peeling back the curtain on mental health issues and how important
We're
it is
looking
to
for the
discuss it.
causes, whether your meds are causing depression. Yeah, that's right.
All right, Dr. Narula, thanks so much.